The rollout of the COVID-19 vaccines has highlighted the importance of why developing countries need to build capacity to develop and produce their own drugs. Less than 1% of the global rollout has been in Africa. The Africa Center for Disease Control and Prevention says it would like to see African countries procure between 40 and 60% of their vaccines within Africa in the next 20 years. African Union member states have been called to finalize an act to help push this initiative forward.
Attention should be centered on multiplying efforts, continental and bilateral, to access vaccine. The elimination of obstacles to distribution and widespread use of vaccines in Africa should be another axis of a strategic commitment. The intensification of our commitments on the continent with our strategic partners for a new world health order, which will create a framework for innovation. I'd like on this note to insist on the African Agency for Medication, which we instituted. We ask all member states to sign and ratify this act.
The idea to have manufacturing regions is to allow Africa to develop vaccines for Africa-specific diseases such as Ebola. The challenges have not been ignored. Member states will have to work together on access to finance and infrastructure, as well as attaining technology and knowledge. President Cyril Ramaphosa says the COVID-19 pandemic has showcased Africa's capabilities in science and in health response. South Africa was one of the first countries to identify a variant of the coronavirus, and Africa is reporting the lowest numbers of infections and death as a region. The president, who is the African Union COVID-19 champion, says setting up manufacturing capacity will aid the continent's commitment to improving healthcare for its population.
Importantly, the leaders of the continent have demonstrated the political will to act decisively in the face of this grave threat to health and well-being of the people of our continent. Our task now is to harness all these capabilities and to draw on the experience of the past year to build a vibrant and innovative African medical supplies manufacturing capability that meets the health needs of the continent's people. This means that in the medium term, we need to expand existing capabilities into regional hubs that serve the continent as a whole.
Ramaphosa says Africa also needs to partner up with developed nations to access resources such as funding and technology and knowledge transfer.
We also need to forge sustainable partnerships with entities in both the developed world as well as the developing world. Partners in various countries could offer technological expertise, financing, and investment. Countries such as India and Brazil could provide guidance on how they developed their own generic pharmaceutical industries. Such collaboration should form the basis of a longer-term strategy to develop a medical supplies industry that can achieve continental scale, taking advantage of the large, growing and increasingly integrated African market.
Meanwhile, the debate on intellectual property rages on. If vaccines are to be developed in Africa, then the sharing of intellectual property must be permitted. Secretary General of the African Continental Free Trade Area, Wamkele Mene, says they will push for less restricting stipulations at the upcoming meeting at the World Trade Organization.
We now have an opportunity when we start the negotiations of the intellectual property rights in a few months. We have an opportunity to craft an intellectual property rights regime that will achieve two things. First, it will ensure that there is a legal framework that will be flexible enough to enable access to public health for millions and millions of Africans. Second, Our intellectual property rights regime must be at the service of Africa's industrial development objectives.
The success of building manufacturing capacity will create more than 3 million jobs in Africa and boost continental trade. World Trade Organization's Director General Ngozi Okonjo-Iweala says the investment into healthcare can only yield strong economic benefits. Noma Bolani, SABC News.